All right. So, melancholy. This is a word you've probably come across a few times before. Maybe in some song lyrics, maybe in a passing reference in a modern novel. If you studied English literature before the 19th century, you've come across this word almost certainly, but I can't take that as a given. So, my own research in melancholy spanned a lot of my studies as an undergraduate through graduate school because I was at varying points in psychology and at other points studying literature, which is what I ultimately took degrees in. But I'm going to base this lecture off of a blog post that I put out recently about the connection between the image of a black dog and depression. And I'm going to use that as a way to jump into the explanation of what I think melancholy is as it might relate to you as students and the areas in which Miranda may be taking you. So, to begin with, those are the two things we have to distinguish first of all. You've heard of depression for sure, right? You have friends or relatives or yourselves have experiences with depression or maybe have a diagnosis or you know someone who has been diagnosed with having major depression. This is a medical classification. It's a disease. It's an illness. It's something that doctors and medical professionals are trained to recognize, to diagnose, and to provide treatment options, either through cognitive behavioral therapy or other forms of talk therapy, or through psychiatric medications, which again, there are all sorts of different classifications. So, a common example of a medication to treat depression would be an SSRI, which was a serotonin reuptake inhibitor. So, again, melancholy is a bunch of things. But what it is most of the time to most people is an old word for depression. Depression, again, is a medical classification of someone who has been so sad for so long at such a great intensity that it's interfered with their normal life. And there are a lot of considerations taken into account when a doctor or a healthcare professional says someone has major depression. There are other kinds of depression, and they are classified in specialized manuals called the Diagnostics and Statistical Manual by the American Psychological Association or the ICD classifications for the World Health Organization. Practitioners use both fairly regularly. So, melancholy is an old word for what we call depression today. If you had been born and had lived in the 19th century and you were depressed, you would probably have been called melancholic. And that would have meant you are so sad that you're not functioning like a normal person. But melancholic or melancholy means a series of other things. And I'd like to get to some of those today and to give you an example of how complex the idea is. So, my definition, my working definition for what depression is something that I use in my own blog post. You can check the definition. I'll send you the link to the post. But for our purposes, mostly mine, depression is severe, prolonged low mood which interferes with daily life. So, again, you are stuck in a mood so bad, and we recognize it as sad, but the mood is so bad and you're stuck in it for so long that you can't live a standard of life that perhaps you had lived before the depression started, right? So if you are used to a certain quality of life and your low mood has decreased that quality of life so consistently for so long, it's gotten to the point where it's interfering with your ability to exist. And again, if a depression gets so bad and is left alone for so long, there are all sorts of health effects, and there's the risk, unfortunately, that the depressed person takes their own life. So I think that that's a good functional definition for depression, and it's close enough to the ones that you would find in the Oxford English Dictionary, but without the jargon that a diagnostic manual would use. Melancholy, and I don't really get into this in the blog, melancholy, by comparison to this, is what the mood of depression feels like. So I said that depression is severe, prolonged low mood. What that low mood feels like to live is melancholy. When you are melancholy, it is an attempt to describe the mood of a sadness so severe that it's hard to put into words. I myself have suffered from bouts of depression. One of the first things I lose when I'm depressed is the ability to communicate at the level that I'm accustomed to. I can't find the words. I get very frustrated. I'm much less articulate. And the only way I can describe how I feel is I tell you that I'm really sad and I don't know what to do about it. So, to segue into the more literary side of this, one of in English cultures, for whatever reason, like British cultures, have these much more developed notions of depression and melancholy, possibly because of the weather that Britain, it's always raining in Britain. And um, English scholars develop these unique ideas that other parts of continental Europe like to take from. And some of those ideas were original, and some of them were taken from other sources, Greek and Latin sources, other cultural sources that they either wanted to admit to or not. But in the 17th century, right, so several hundred years ago, there was a scholar named Robert Burton. This is my copy of the Anatomy of Melancholy. I don't think that the writing is legible in this glare, but I have in my paperback copy of the Anatomy of Melancholy, you can find basically a whole compendium of all of the sources that explain to people what depression meant in the 17th century. And these ideas were influential for about a couple hundred years after that. But the idea for Burton, this is a very famous line that he uses as the initial definition or a working definition for melancholy. He says that melancholy is sorrow without a cause. So sorrow you'll probably recognize as a different word for sadness. Sorrow would be more intense, more prolonged, more poetic. Everything in poetry is always more intense than real life. So sorrow is a more intense version of being sad. Sorrow without a cause. So it would be basically the way that I would extend his short definition into something a bit more to our taste, to our way of speaking, would be that melancholy is being really sad for no good reason. Without a cause, I would render as for no good reason. So sometimes you feel sad because you watch something on television and a character you love dies, and you come away from that episode of TV feeling sad about that outcome, but there's a reason for that. You saw someone that you cared about in a piece of fiction go away. You're sad you're not going to see that person anymore because they've been written off the show or whatnot, right? That would be sorrow with a cause. When you can explain the reasons why you're sad, that's not melancholy, according to Burton. When you are so sad that the reasons for it escape you, because if you feel genuinely sad as you go through your day to day life, it's as if something terrible has happened. But the sorrow without a cause would mean that you're not able to identify why, which is often why depression is so pernicious. If you don't understand why you're that sad, it's really hard to take steps in order to improve it. And often the process of therapy will allow the patient or the client talking with the therapist, whether the therapist is a government public servant or a private clinician working out of an office. The therapeutic relationship is to help you come up with a reason for your sadness. Once the sorrow has a cause, normally the sorrow begins to improve. One of the things they do with depression in diagnostics is, this is a controversial area and it would depend on when in time we are. Therapists would have different points of view on this. But if you lose a family member, you go through a process of mourning. Mourning is not often considered a depressive episode. So if I fall into profound sadness as a result of the loss of a family member, I am not likely, this is changing today, but I am not likely at certain points in our recent history to be considered a depressed person. I might not I might be encouraged to seek therapy, but I probably wouldn't be prescribed medication because it is natural to fall into profound sadness during the grieving process when you lose something or someone that you really care about. So this dovetails into the example I made about watching TV. Like if you see a character die on TV and you're a little bit sad, it is natural. There is a cause for that. You lost something, you felt emotions as a result. The deeper the loss, the more profound the emotions. So it would make sense that if I lost a parent, I would not be well for a period of several months, if not years. When you lose a family member, there's always something that you've lost forever as a result of that. Now, if I 6 months, a year, 2 years away from losing a loved one am still in that state, um, that's where a medical intervention would take place. Now, if we take a step back from depression back into melancholy, melancholy was not just the mood that you got into when something sad happened. Because again, in the Burton's way of putting it, sorrow without a cause. If you are confronted with a problem that has no clear solution, if I am confronting a problem out there in the world and I'm not able to fix it, and it affects me so profoundly that my inability to change it makes me feel bad, I start entering into that low mood state that starts qualifying for what we would consider to be a depressed person. And what if someone, just by being themselves, were disposed to being in these bad moods? So we know through culture that a lot of the great artists who have blessed us with their talent and their works are people who are very moody. They can be difficult. They don't they snap at people for reasons they don't understand. Sometimes they abuse drugs and alcohol. Sometimes they have difficult family relationships. And we kind of accept this behavior because their moodiness produces something that no one else seems to be able to make. And that's where we get into the arena of melancholy and art that I studied when I was in graduate school. Because there is a connection between people who confront these kinds of bad moods almost on purpose and then take something out of it and turn it into something beautiful. So, a lot of the great artists, if you read their biographies, you'll encounter that they were often sometimes they had difficult lives, sometimes they were moody people, but they were often depressed, and then there were moments where they came out of those depressions and then they were very productive and they created a lot of works. There are a lot of artists who try to portray what that depression feels like and the inspiration that might help the person come out of the depression. So, melancholy is a way of describing an intellectual state of mind. Now, there have been periods in history, and Robert Burton's period is one of them, where there were a lot of rulers who were causing a lot of problems all over continental Europe because they were very moody, temperamental individuals who started wars because of those temperaments and because they were kings. They had the power to cause all kinds of trouble. We're seeing that happen in the American context as we speak. Melancholy is not a state that one ought to look for because, again, melancholy and depression are essentially the same thing. It's just melancholy is an older, more complicated version of depression. If you go out looking for bad moods, you'll find it. And being in a bad mood all the time is dangerous. And one of the points that Burton makes, and this is where I'll probably cap this off for today. One of the points that Burton makes is scholars are people because they're trying to solve the big ideas of the world, and they can't solve them because some ideas are so incredibly difficult that they're almost beyond us. They enter into these dangerous low moods, and if they don't work their way out, they may never come out of it at all. Burton, being a scholar himself, was often depressed, often by himself, often very lonely, felt very isolated. Isolation creates conditions that allow depression to fester. So the idea of melancholy is that being in that state, being in sorrow without a cause, doesn't mean that you're excused from looking for a way out. One of the great triumphs of artists and philosophers is that the work that they do, the day-to-day reading and writing and creating that they do, is often something they've trained themselves to do over long periods of time to pull themselves out of depression. So when Burton is talking about sorrow without a cause, he starts there, but he then spends what is a 3 volume, several thousand page book that he worked on his entire life finding solutions out. And one of the things, and this is something he says at the end of the book, is be not idle. It's a reframing of a Christian principle against being lazy. The best way to get out of a melancholic mood is to work through it, to go through the bad emotions and to come out of it. And this actually resembles what we would call today a therapeutic process where the patient works their way out of their own depression because they're able to find reasons as to why they were so sad. So that's the first 15 minutes. That's a good way of covering the melancholy. And I'd like to make a practical example out of these rough definitions by talking a bit about nostalgia.